Hello, everyone. Welcome to Lupus You, Answers, Advocacy, Action. My name is Ashley Holden, and I will be your host. Tonight's program will focus on lupus and the brain. Next slide. So this is an overview of our program. I will be sharing more about the Lupus Foundation of America, some helpful resources and ways you can get involved. We are also so excited and honored to have tonight's speakers. Each of them will share information about the aspects of living with lupus and brain involvement. Kimberly Burnett is our motivational moment, our speaker for that this evening. We will also have Dr. Tuma speaking about the impact of lupus on the brain. And then we have Dr. Segan, who will discuss ways to cope with brain fog. Next slide. So before we begin, I do have a few housekeeping items to go over. So if at any time you have a general question that you would like to submit to our speakers, you can send it through the Q&A function at the bottom of your screen. Just click on that and type in your question. If you would like to submit your question without providing your name, there should be an option to do so anonymously. And you can select that when you do submit your question. We do have time allotted at the end of tonight's session where our speakers will answer those questions. If you do have questions that are more specific, you can reach out to our health educators, and we have a web form available on our website where you can do so. And so that website is lupus.org/health-educator. Tonight, we will also have opportunities for you to interact with us and each other. So throughout the program, we will have polls that you can respond to, and you can also connect with each other via the chat. So feel free to say hi in the chat function, tell us where you're from, and feel free to just interact with each other and share your experiences there. And then finally, I do want to share that this program will be recorded, and you'll receive a link to the recording along with helpful resources and a post-event survey where you can submit feedback for tonight's program. So we'll go ahead and move to the next slide, which is our first poll that we have this evening. And we'll give that a second to pop up. So our first poll, thinking of that it is December. So what is your favorite winter activity? Skiing, drinking hot cocoa, bundling up with a book, going to the beach, or I don't care for winter? And we'll give us about 20 seconds to respond to that, and then we'll look at those results. Okay, we'll give it just a few more seconds, maybe 10 more seconds, and we'll go ahead and close out that poll. Great. All right, let's go ahead and look at those poll results. So it looks like the majority of us like to bundle up with a book. And we have a lot of people that don't care for winter, drinking hot cocoa and skiing, rounding out the top. But we also have a few people that like going to the beach. So we must have some people that live in warmer climates or climates joining us this evening. Great. Thank you all for participating in our first poll that we have this evening. And we'll go ahead and get started with some of our resources. And as I shared, I'll be sharing some of those resources that we have from the Lupus Foundation of America. Next slide. So a little bit about the Lupus Foundation of America. We work to meet the diverse needs of all people with lupus. Our commitment has never wavered over our more than 40 years of service. And today, people with lupus are living longer, healthier lives than ever before. And the Lupus Foundation of America has played a significant role in that achievement. We remain resolved to doing everything we can to help you navigate the complexities of lupus while rallying every possible resource to end it forever. To put this simply, our goal is to one day end the impact of lupus and its suffering while ensuring that we provide comprehensive support and programs to people with lupus, programs that people with lupus need today. Next slide. So our programs stand upon three pillars: research, care and support for people affected by lupus, and advocacy. We have redefined lupus research to expand our efforts beyond just funding research grants. We are engaging all stakeholders to identify barriers that stand in the way of progress and setting a course to overcome them. And we do this while providing caring support for people affected by this devastating disease and leading advocacy efforts to bring more funding for research and services. Next. So our approach is comprehensive and focused on achieving meaningful results that will make a difference in the lives of people affected by lupus. To that end, we align our efforts and resources towards achieving 4 specific outcomes. So we aim to improve early diagnosis of lupus by increasing awareness of symptoms and educating health professionals so people with lupus get prompt care and treatment. We also secure new, safe, effective, and tolerable treatments for people with lupus by advancing research, improving how new treatments are evaluated, and educating people about clinical trials. We also expand direct services and increase access to treatments and care by providing resources and advocating for improved health services and affordable medications. And finally, raising money and securing government funding to operate programs that help people affected by lupus. Next. So people with lupus represent the heart and soul of our organization. You are the central focus of everything we do. You are a constant reminder of our mission's urgency and serve to motivate us to continue this fight. We understand the emotional turmoil, economic hardships, and physical suffering caused by lupus. We get it. Because of you, we are motivated to work harder and faster to bring lupus under control so everyone can have a life free from lupus. Next. So I'd like to switch gears just a little bit and talk about some of our programs and resources we have available to you. So some of those things include support groups. So we have more than 100 support groups across the country where people with lupus can come together. You can also join Lupus Connect, which is our online support community where members can engage and ask questions. And we also have the Expert Series, which is our monthly educational podcast from lupus experts, touching upon topics that we know are important to you. Next. We also have our National Resource Center on lupus, and that is your one-stop shop for all things lupus, from treatment to living and coping with the disease. It aims to ensure that anyone affected by lupus, including those diagnosed with lupus, caregivers, healthcare professionals, all have access to high-quality resources that provide emotional support and clear, accurate health information. We know the importance of having accurate information out there. Next. I also want to share a little bit about Ray with you this evening. So we know that people with lupus are so important to the research process, and that's why we've developed our new online research platform called Ray, Lupus Research Accelerated by You. And so we've made significant progress in lupus research, but we're far from over in our quest to solve this cruel mystery. And we know that researchers need your help. You can help advance lupus research right from the comfort of your own home by participating in Ray. We ask that if you join Ray, you share your experiences with lupus to help inform future clinical trials of new lupus treatments and identify the most pressing needs of people with lupus. No one understands lupus better than those living with it. So as part of Ray, you can compare your experiences with others, get updates on new research studies, share medication and health information with your doctor, and really truly help brighten the future of lupus research. And so, as I mentioned a bit earlier, we do have more than 100 support groups across the country where people with lupus can come together. Many of them are currently meeting virtually. So even if you don't have a local one to you right now, take a look and see if there's a virtual one you can join. But in addition to those support groups, we do have a network of chapters and regional offices that offer local programming, support, and events. Visit lupus.org/chapters to get connected and find your local support that might be in your area. And finally, here's more information on how you can reach out to us and also follow us on social media, which is a great way to stay updated on all of the programs, events, and services that I've mentioned tonight. I'd also like to mention that we have health education specialists available to provide people with lupus, their families, and caregivers with non-medical counseling, disease education, and helpful resources. Even if you don't need a health educator right now, keep that in your back pocket should you have a question, need information, or if you in the future meet with somebody that is newly diagnosed, it might be a great resource to share with them. So our health educators can help you or someone else with lupus find trustworthy information to answer questions about lupus, how to cope with it. And so you can contact a health educator by filling out our online form that I mentioned earlier at lupus.org/health educator. We also, if we have our number listed on this slide, you can call that number and there's an option to speak to the health educators there as well. And it's worth mentioning that we do have bilingual health educators that also speak Spanish. So again, just a great resource that I want to mention as we get started this evening. Next slide. Great, so we have our next poll before we jump into our first speaker, and we can go ahead and pull that up. And so our poll is, do you struggle with cognitive dysfunction or brain fog due to lupus? And the options are yes, no, or I'm not sure. Looks like these answers are just pouring in. We'll give it just a few more seconds. And I see some people chiming in the chat as well. It looks like we have a good amount answered here. We can go ahead and wrap this up in the next couple of seconds with the poll, maybe 5 more seconds. All right, let's go ahead and close the poll and look at those results. So an overwhelming amount of you, 70% of the respondents say yes, you do struggle with cognitive dysfunction or brain fog. We have a fair amount, about 26% that are not sure, and 5% saying no. So maybe we have some caregivers or we're just not sure, or you're very fortunate. But that's a great way for us to lead into our first speaker. We'll go ahead and close out that poll. We'll go to the next slide. And so we are going to do our motivational moment first, as I mentioned, and our speaker tonight is Kimberly Burnett. And so Kimberly is an accomplished lupus advocate and survivor. As a patient, she has passionately championed the advancement of lupus research and awareness. This experience has come from a hard road of personal experience. In 2012, she began to experience grand mal seizures. The seizures immediately put a halt to life as she knew it, as at this point she was deemed disabled and was unable to work. Despite multiple life-threatening diagnoses, and while undergoing aggressive treatment, she graduated from the University of Phoenix with a Bachelor of Science degree in Human Services and Management. And she dedicates her time to nonprofit service and motivating others with lupus. And so I'm so excited to welcome Kimberly this evening to share her story with us. Kimberly, please feel free to turn your camera on and unmute yourself when you're ready.
Y'all see me? There we go. Okay. Can you hear me?
Yes.
Okay.
Yep.
There we go. Hey everyone, I'm Kimberly Burnett, and just first of all, I just want to thank you all for coming today. Whether you're a patient, a caregiver, a doctor, somehow we've all been affected by lupus, and so just it really it's good for us to just care enough to take our time to do this. So basically, I was diagnosed with lupus in 2010. I too had brain fog. I think we all have that. But in 2012, I started having grand mal seizures in my sleep. And they couldn't figure out why, but I started going to a neurologist. They gave me anti-seizure meds. I was on a few different ones. But then in 2014, I had a stroke. And so it was at that point that, they're just really looking at my brain like, what's going on with it. And they just basically diagnosed me with CNS, cognitive, that lupus was attacking my brain. So for the next, I would say 10 years, or rather 6 or 7 years, I went on and I was just having so many seizures and things like that. And they really couldn't figure out why, but they finally did get them under control I take 3 different seizure meds. I went through a pregnancy while on seizure meds, and thankfully I had 1 seizure during that time, but overall, pretty much healthy pregnancy. What ended up happening for me is I ended up having brain surgery due to lupus. I don't want to scare any of you at all. That's definitely not my goal, but I just do think it's important to share my story because oftentimes when we talk about lupus, we talk about kidneys or we talk about other organs, but we don't always talk about the effects that it can have on the brain. From when I had my seizures and when I had the stroke that I had, it left dry blood and scar tissue on my brain, but I didn't know that. What ended up happening is my family moved across country and I had to find a new doctor. Thankfully, we moved back to California, where we're from. And when I went back to my initial doctor, he was like, hey, there's something here that we didn't see before. I'm like, okay, what do you mean? So he did MRIs and he looked and he was like, hey, you have this dry blood and scar tissue from lupus attacking your brain. And so because of that, your brain in that particular area, which was my front right temporal lobe, is not working. And lupus has attacked it so much that we have to take it out. And so I'm thinking they meant take out the scar tissue and dry blood, but they meant take out my right front temporal lobe. So November of last year, I had brain surgery. And it was, it's terrifying because how many people have brain surgery, but I went through that and I had double vision. I had all these things that were happening, but I was very fortunate because of the fact that they were able to find it and they were able to they said basically like kind of rewire my neurons so that as lupus was attacking my brain prayerfully, it would diminish the seizures that I was having. So it was crazy because I never knew that lupus could do something like that. I knew that I would forget stuff all the time, but I never would have thought that it would be something as serious as it's called a craniotomy. And so they literally like take part of your brain out. So I literally gave them a piece of my mind, like legit. I did that. But I'm really here just to one, share my story just in case there is anyone who feels any type of cognitive issues. It's so important to have a team of doctors who are going to be proactive. One of the issues that I had with my neurologist that when I moved, they never did MRIs on me. And being a patient, I didn't think about it. I just was going to the doctor. But thankfully, when I went back to my initial doctor, he's like, well, we need to have MRIs to be able to compare them. So I think it's just so important for for us to be our own advocates and make sure that our doctors are doing, we have to remember we're a team. It's not just them telling us what to do, but we're working alongside of them. So, like I said, I don't want anyone to be scared, but I do want you to have the information. But I also want you to see that you can survive it. I think that us warriors, we all have different stories, but we're here together and we're surviving it. And honestly, it's made me so thankful to be alive, because I've had brain surgery and I don't know too many people who can say that they've had that, but I'm here and I'm able to share my story in hopes that, hopefully no one else really has to go through this, but at least if they do, they know that one, the LFA is here for them. I'm here for you to answer whatever questions. And, it wasn't exactly the easiest thing to go through, but I'm here. And so I'm thankful for that.
Thank you so much for sharing your story, Kimberly. As a health educator, I speak to people with lupus, but every time I hear personal stories such as yours, it always gives me chills. And I see people just lighting up in the chat and thanking you for sharing your story. So we're so happy to have you with us tonight. And I know that we'll have some questions for you when we get to that Q&A portion. Thank you so much again.
Thank you.
Okay, so next, we'll have the next slide. There we go. So we're going to have our next speaker. And so I am so honored to introduce Dr. Tuma. Dr. Tuma is an associate professor of medicine, clinician scientist with the University of Toronto, and a staff rheumatologist with the University Health Network, Mount Sinai Hospital. His research is focused on measurement science and SLE, particularly the assessment of disease activity, patient-reported outcomes, and cognitive function. Dr. Tuma is a co-chair of the criteria subcommittee of the Quality Care Committee of the ACR for the development of a classification and response criteria for rheumatic disease. He is also a member of the Medical Scientific Advisory Council of the LFA and the Medical Advisory Board of Lupus Ontario. And with that, I am pleased and honored to introduce Dr. Tuma. Please feel free to turn your camera and unmute yourself when you're ready.
Thank you, Ashley. I would like first to acknowledge the organizer and the LFA for inviting me today to talk about lupus and the brain. Next. So as we know, lupus is a chronic autoimmune disease that affects multiple organs, including the brain, which is the topic of today's presentation. Next, please. So when we talk about brain involvement, we refer to this as well as neuropsychiatric lupus, or NPSLE, or often as well NP shortly. So the American College of Rheumatology has described 19 manifestations or syndrome to kind of categorize or group all the manifestation of brain inflammation. And when we read the literature, this prevalence can go from 14% up to 75%. And I have listed here on the right side of the screen the 19 symptoms or syndromes. And as you can see, we've got headache, movement disorders, seizures. We've just heard about this, anxiety, cognitive dysfunction. I circled it because I do have more slides on cognitive dysfunction for today. Next slide, please. And I already saw some of the important question, which is how do we know if the manifestation that the patient is experiencing is related to lupus or not? So I've put here this figure in the context of neuropsychiatric lupus, but really this is applicable to every manifestation when we see a patient in the clinic, whether it's brain inflammation or it's skin. You need to know at the end if this is lupus related or not, because the treatment is different. And as you can see here, the first I've put is lupus. And on the, we have the causality axis, or the cause here of the manifestation is lupus. And particularly, we're talking about neuropsychiatric lupus, which could be seizure or stroke that is related to lupus activity. Then if you make this diagnosis and attribution causality, then the treatment would be eventually prednisone, immunotherapy, blood thinners, anti-malarial like Plaquenil, and for sure you have to treat the symptoms. Next slide. But at the same time, and I always say this, if we are a lupus patient, doesn't prevent us from having what the general population can have, or any person can experience. So if you are a lupus patient, you can also have a headache. And after a certain age, we can have stroke that is related to atherosclerosis, or we say it's a stiffness of the vessels. And this is important to know because in this case, this stroke is associated with lupus. It's not related to lupus directly, and the treatment is different. So in this particular situation, we don't need to use prednisone and we don't need to use immunosuppressant. So clearly here you can see how important to make this attribution to lupus. Next slide, please. To facilitate this, in the literature, there have been a model or algorithm that will help you to determine the attribution. One of these is the model A and model B, something that have been introduced in 2002 by the SLIC group or the SLE international collaborating clinics. So it's a large list, and you go through different questions to determine if this is related to lupus or not. And more recently, the Italian group has introduced as well an algorithm that can facilitate as well the attribution. And also it has different question and weight score. And at the end, you get a total score also that can direct your healthcare team to know if this lupus, if this manifestation is lupus related or not. Next slide, please. Now, neuropsychiatric lupus, that it's related to lupus activity, usually it happens often within the first year or within the first 5 years after the diagnosis of lupus. And often it can precede a little bit the diagnosis of lupus, which make the diagnosis more challenging. So in general, the prevalence of this event within the first year can go from 6 up to 28%. And 1/3 of these manifestations are related to lupus activity. Now, regardless whether related to lupus activity or associated with lupus, we know that it affects quality of life and can increase the damage that patient can accrue over time. And I've listed on the bottom of the page 2 types of classification for the neuropsychiatric lupus. So we've got on the right side, on the left side, the diffuse manifestation. And here we include cognitive dysfunction, headache, depression, anxiety, psychosis, and other. While the focal, we've got stroke, seizure, peripheral neuropathies, and other. Next slide, please. Now, probably you're wondering what caused neuropsychiatric lupus. So let's try to explain some of the factors here. And I've listed on the top the disease activity from lupus, which we know it can cause inflammation of the brain and direct different neuropsychiatric lupus. At the same time, you've got antibodies, and that's very typical with lupus. A blood clot, which we see it often as well in lupus patient, because lupus can be a hypercoagulable state, which increase the tendency for blood clot. And blood clot could be in different organs, including the brain. At the same time, we know that lupus can cause inflammation, cytokines, and other that as well inflame the brain. But we don't have to forget that some of our medication can give us as well, you've heard about brain fog. For instance, prednisone could be associated with this, or different antipsychotic medication as well can give you brain fog. And also in certain situations, we know that anxiety and depression can be associated with brain symptoms, particularly brain fog. Next slide, please. Now, if we want to divide the pathogenesis or the way things can develop in the brain in terms of inflammation, we have 2 major pathways. The first one is inflammation with cytokines and antibody production, which cause direct inflammation of the cells of the brain. And the second mechanism is clots and blood clots, which can cause decreased supply to the tissue of the brain. We call it ischemia or vascular injury. Now, often, let me tell you, you cannot delineate between these mechanisms, and we have both of them coexisting at the same time. Next slide, please. Now, how do you investigate when you have suspicion of brain neuropsychiatric lupus or brain involvement? Things start with good history and physical exam with the patient. We do different laboratory imaging and tests as well. Next slide, please. So as I said earlier, the majority of the neuropsychiatric lupus, which is attributed to lupus activity, they do occur close to the diagnosis of lupus or within the first 3 to 5 years. But we have to remember that it can happen as well late throughout the course of the disease. And it can be more challenging to make a diagnosis and to delineate again, is this lupus activity, causality, or just an association with lupus? So again, here I stress one more time on the clinical history, physical exam, lab test, and neuroimaging. Next slide, please. So there are 3 major steps that we have to achieve to get an accurate diagnosis for neuropsychiatric lupus. First of all, eventually, you have to confirm the diagnosis of systemic lupus. Then 2, and you've heard already the story, which was very important from Kimberly, highlighting the importance of the imaging, because we have no specific imaging yet or blood test to say that this patient particularly is experiencing neuropsychiatric lupus. But we need to rule out infection, metabolic problems such as low sodium, thyroid disease, anything that can mimic or can look like things related to neuropsychiatric lupus, malignancies, medication adverse event. So, and once you have this differential, then you move on and you start doing your laboratory tests and different imaging. So laboratory tests, again, we have no specific blood tests that we can use in the clinic so far that can tell us if the patient has brain inflammation from lupus or not. But we know that we can use different antibodies that we test for lupus to confirm the diagnosis of lupus. We do often analysis of the CSF or the cerebrospinal fluid to rule out infection and to rule out other causes as well. And imaging for sure, which I'm going to talk about this later on. Next slide, please. Now, it's very important when you make a diagnosis of neuropsychiatric lupus to set the goals and have a discussion with the patient. What are the expectations? When do you expect that certain manifestation, if you have seizure, or if you have a stroke, or if you have cognitive impairment, when do you expect this to improvement? How long does it take? Share with the patient the adverse event that can happen with the medication. All these are very important goals to set and make it clear for the patient a priori. Next slide, please. Now, there are principal components to remember for the management of neuropsychiatric lupus, and I've already talked about it in previous slide. We know that still up on nowadays, what works very fast to shut down the fire when we have activity from lupus is prednisone. And we need as well immunotherapy often when we have brain inflammation. Often we're going to use as well antiplatelet or antithrombotic, which means if we have blood clot, these are type of medication we use to prevent blood clotting, but we don't have to forget symptomatic treatment as well. So if we have a patient with symptoms of psychosis or depression, yes, you're going to treat with prednisone and immunosuppressant, but this might take on to kick in. So don't forget as well to treat the symptoms as well. Next slide, please. Next slide. Just click enter. So the physician and healthcare team, often we spend a lot of time measuring disease activity of lupus, using our instrument and damage. Next step, but we have to make sure, and next as well, not to forget as well about patient-reported outcome. And as you can see here, there are a lot of aspects or facet of the lupus manifestation that you can appreciate when you measure or get patient-reported outcome. You will learn about cognitive function reported by the patient, about their sleep, coping, quality of life, pain. And I saw some of the question already, how can we differentiate if cognition is related to lupus or not? Well, if you measure these patient-reported outcome, they're very important to help you differentiate down the road what are you dealing with. Next slide, please. So I'm going to shift gear here and talk about few manifestation of neuropsychiatric lupus, particularly depressive symptoms or depression. Next slide, please. We have recently presented this study at the American College of Rheumatology this month virtually, the meeting was. And this is data from UCSF with our colleague, Dr. Parikatz, and the student, Sarah Chola. And this is a very novel analysis here. And it's showing about depression over time. So we know that lupus patients do have a high prevalence of depression, probably around 30 to 35%, which is almost double what we see in the normal population. And this is based on one single time when you see the patient. But it's very important to know what would happen with depressive symptoms over time. To answer this question, we analyzed this data from almost 800 patients who were assessed annually over 7 years. And you can see here on the top of the screen in red color, which represent 10% of the patient, and orange color, 22% of the patient. These are patients who continue to have over time high score when we test for depression, means they continue to experience symptoms of depression over time. While other patients in green and blue, which constitute almost 55 or 60% of the patient analyzed here, they did actually have no symptoms of depression. Next slide. And maybe you're wondering, do the patient continue to follow a straight line? No, they don't. And if you look carefully here at the screen, in red color, again, this is the group that experienced very high score, meaning a lot of symptoms of depression. We can see that there is a little bit of variation it goes all the way up to 55 and can drop to 30. But still, if you combine these dots together, you get the trajectory, the gist of the depressive symptoms over time. Next slide, please. Let's shift gear and talk a little bit about cognitive function. Next slide. And what do we understand by cognitive function? So the American College of Rheumatology has defined different domains for cognitive function. And I've highlighted this here on the slide. You've got attention and speed processing, manual motor speed, verbal fluency, learning and memory, and executive functioning, which means an example for executive functioning. If you want to use your Visa card and pay with it, or if you're planning for an event, all this can be captured under the executive functioning. Next slide, please. So what we know that cognitive impairment is highly prevalent in lupus patients, and you've heard about this. In general, the prevalence is 38%, but if you read the literature, depends on how you're measuring this and how you're defining cognitive impairment. It can go up to 70% in some of the studies, but we know for sure that this is 2.8 times more likely to see cognitive depression, cognitive impairment compared to the general population in lupus patient. And when we compare to other rheumatic diseases such as rheumatoid arthritis, it's also 1.8 times more prevalent in lupus patient. We have done as well another systematic review, and we've learned that currently we're using different tests to measure cognitive impairment. So we need kind of to homogenize the way we're doing cognitive assessment, because this will help us to move the field forward. And at the same time, we have noticed the emergence of new screening tests, particularly the use of computerized tests to assess for cognitive function. And I'm going to show you this on the next slide, please. And these are the domains that I've highlighted earlier. So here you can see the battery that was proposed by the American College of Rheumatology. It captures 6 domains with multiple tests. But this battery require a psychometrist, which means a trained personnel who can administer this test. You need a psychologist, neuropsychologist, as well neurologist to interpret the data. So this can be associated with cost and time burden. So definitely there is no doubt that we need to validate screening tool that can be used in the clinical setting to identify patients with cognitive impairment. Next slide, please. So we've done this study in our clinic where we assessed 300 participants with lupus. And here in different color, the red, far on the right side, the red, green, and blue, you see different definition for cognitive impairment. But there is no doubt, if you look at the blue color, we know it goes all the way from 40 up to 60. Depends how you're gonna define cognitive impairment. And when we look among lupus patients, which domain is more affected, we can see high prevalence in learning and memory, motor speed and dexterity, visual spatial construction, and executive functioning to some level. Next slide, please. Now, I mentioned that the American College of Battery is the gold standard, and this is a test that can take up to an hour or 2 hours to administer, and you need the personnel to analyze the data and score it, and neuropsychologists to be involved as well. But at the same time, you can have a computerized test, and I just listed one of them here, which we have in North America. It's the ANAM test, where the patient, while waiting for their assessment, they can complete the test with minimal guidance on how to do the test. And at the end, you can generate different score and facilitate the evaluation of the cognitive function. Next slide, please. Now, in our study, what we've done here, we assess patients at baseline, then we followed with them at 6 months and 12 months to see what's happening with their cognitive function. So what we found in light blue color, that 44% of the patient continues to have stable, which means normal cognitive function. But in light blue, you can see that 42%, they fluctuate between normal and lower cognitive function. And in dark blue, you can see patients where they have persistently cognitive impairment over 3 visits. We tried to analyze what can be some of the factors associated with this. And we found that disease activity, depressive symptoms can be associated, increase the likelihood of belonging always to the persistently cognitive impairment group over time, while higher education and increase in age can increase the chances of belonging to the group with stable cognition. Next slide. Now, if you're wondering what other factor can help us to predict if the patient will be always in the category of the low cognitive function, as you can see here in red color and on the y-axis, patient who started with very low score on the cognitive function, probably they have higher likelihood to continue having low cognitive function over time. Next slide, please. Now, let's shift gear and talk about some of the assessment. So as I mentioned earlier, we have no specific tests to assess brain inflammation, but we utilize MRI to make sure we don't have something else. Rule out infection, malignancy is another. At the same time, we have seen now the emergence of new modalities such as the functional brain imaging, which have future to help us address different aspects of brain inflammation. Next slide, please. I want to highlight on this as well, because we're currently doing some work with our Dr. Michel Baraclou, who has actually joined recently our lab. And we think probably there is different phenotype for cognitive impairment. And we think maybe there is a difference as well for brain fatigue and cognitive impairment. So brain fatigue, maybe this is something we can experience more if we have a lot of anxiety, probably depression, or let's say one night we didn't have a good sleep, we might develop early brain fatigue. It can manifest as cognitive impairment. But in patients with persistent cognitive impairment, probably this is a different phenotype of cognitive impairment itself. Next slide, please. So kind of to summarize here, what have we learned? We know already that there is a high prevalence of cognitive impairment in lupus patients. We do know that there are different tests that have been used so far, but it would be great if we can homogenize and use a single test to assess this moving forward. There is no doubt that cognitive impairment in lupus patient is not similar among all patients. Lupus itself, it's a disease of 1,000 faces. And here we're saying as well, there are different types of cognitive impairment, and this has an implication on treatment. Next slide. And next, please, because I've already highlighted this. I want to keep in mind that we have only 20 minutes. Now, what are the treatment options? And we're going to hear more about this from Dr. Segan. Coping strategies, treating underlying conditions. And this is why it's important to focus on the reported outcome, because you can address a lot of these aspects if you learn about it: sleep, depression, and fatigue. We have ongoing trial for the treatment of cognitive impairment, because up until now, we have no specific medication for this, and no doubt rehabilitation as well. Thank you. I will end here.
Great. Thank you so much, Dr. Tuma. That was very informative. I saw a lot of questions come through in the chat and the Q&A. And one that stood out to me was the comment that said that you really understand the troubling symptoms that lupus patients face. And so that really just speaks to me. So thank you so much. And I know that we will have a lot of questions when we get to the end of this session. We have our final poll for this evening, and we'll go ahead and pull that up. And so this question is, what are some ways you can cope with forgetfulness due to lupus? And the options are make lists or use a planner, try to accomplish one task at a time, work with a doctor, rest, or all of the above. And we'll just give us a few seconds so we can try to stay on time as much as possible and get to those questions at the end. About 5 more seconds. It looks like everybody, the responses are slowing down. Okay, great. Let's go ahead and close the poll and take a look. So it looks like the majority answered that all of these are great answers, and that's very true. And it looks like some other things work great for individuals. So about 37% like to make lists or use a planner. 22% try to accomplish one task at a time. 19% like to rest, and 5% said work with a doctor. So these are all great options for someone that's trying to cope with forgetfulness due to lupus. We'll go ahead and close that out and move to our next slide and our next presenter. And so we have Dr. Page Segan, and Dr. Segan is an assistant professor and licensed clinical psychologist at Johns Hopkins in the Department of Psychiatry and Behavioral Sciences, Division of Child and Adolescent Psychiatry. She specializes in the assessment and treatment of children, adolescents, and young adults with acute and chronic medical conditions. She's also been trained to work with adults as well. And Dr. Segan utilizes various modalities of evidence-based practice to assess and treat medical non-adherence, anxiety, depression, sleep, weight management, and behavioral challenges in patients with acute and chronic illness. She enjoys consulting and working closely with multidisciplinary treatment teams to help promote adherence to medical regimens and patient and family coping with chronic illness and related disabilities. So we are pleased to welcome you, Dr. Segan, and please feel free to turn your camera on and unmute when you're ready.
Thank you so much. It's so nice to be here. And I just wanted to thank, is my camera and mic working okay?
It is, you are good to go.
I just wanted to thank the Lupus Foundation and organization administration for allowing me to join tonight, and Dr. Tuma as well. So tonight I'll be talking about coping with brain fog, as well as just managing stress in general related to lupus. So, and you can click through all of those. I think what, oh, oops, sorry, back one slide, there you go. So one thing I wanted to just kind of reiterate or summarize is I've been looking through the chat, and a lot of people experience a lot of similar symptoms, but then there's also a lot of variability to symptoms too. So tonight, I hope I kind of am gonna give you some direction for things that you can do to help manage the distress you may be experiencing around symptoms associated with lupus, but there's a lot of things you can do, and hopefully I can answer any questions during the question and answer period. One thing I think we all would agree with is living with lupus can be stressful, and stress can then trigger our lupus and trigger flares and can make those symptoms worse. And then it becomes this kind of cyclical cycle that you feel bad, you get stressed, that you feel worse. And we'll talk about this on a couple slides in the future. But one of the things to think about is all the different symptoms. And Dr. Tuma also mentioned some of these: depression, anxiety, headaches, pain, fatigue, brain fog. One of the things that all of these things has in common is issues with concentration. So anxiety and depression alone, regardless of lupus, you can still have problems with concentration, but then you add in other cognitive symptoms or fatigue, and that concentration can worsen over time. It can lead to increased stress because you can't remember the things that you want to remember. And again, that cycle continues. So one of the things or ways that we might be able to break the cycle, and is specific to brain fog, because brain fog could include things like not being able to think clearly, memory problems, difficulties multitasking, and just general confusion and trouble concentrating, is to minimize the distress that we're experiencing. And so how do we cope with our general stress, which would then hopefully decrease our frequency or intensity of symptoms related to brain fog? One of the things that I want to focus on today is called mindfulness. So if you could please go to the next slide. So mindfulness, I think one of the ways to describe what mindfulness is by thinking of mindlessness. So the things that you do when you're in autopilot, the things you don't even think about. So for better or for worse, oftentimes people say driving is like they can do that on autopilot. So you may not be paying attention to the moment-to-moment changes when you're doing something like driving home from work. But mindfulness is different. Mindfulness is when you're actively paying attention in a very particular way. And there's three things that are involved in mindfulness. So one is the next bullet, which is paying attention to something on purpose. So if you wouldn't mind clicking, there you go. And then again, you're paying attention to things on purpose in the present moment. And then also non-judgmentally. And I think that's the hardest thing for people, is to not judge ourselves. So for example, if you forget something, you might think, oh, I can't do anything right, or I'm never going to get better. And then that might make you feel a lot worse, which causes more emotional distress that then may actually place you at risk for worsening symptoms of brain fog because of that distress, because of, being judging yourself, being judgmental and thinking, oh, I'm just not, I'm stupid, I can't do this. The unhelpful thoughts that we tell ourselves sometimes in the context of distress. So mindfulness practice may help us to understand that accepting rather than fighting our difficulties may make it a lot more manageable. Next slide, please. So one of the things that we have to talk about, if we're going to talk about mindfulness, is our mind-body connection. And so I've already alluded to this, but unhelpful thoughts that we have about ourselves or our ability or our symptoms can trigger a stress response. And then similarly, physical symptoms can trigger negative thoughts. So it can start with our physical symptoms of pain or fatigue, or cognitive symptoms of brain fog that then lead us to have really unhelpful thoughts about ourselves, or it's our unhelpful thoughts that we have about ourselves that can actually lead to increased stress, which increases our risk of having a flare. So what we want to do is try to break that cycle so that we're not continuously, feeding into that maladaptive cycle. One thing that we can do is think about how our thoughts impact our experience of things like pain or stress. And I use this example a lot with people, like if you stub your toe and you just think about how much your toe hurts, that's probably not going to help you. It's probably going to make that pain a lot more intensified. So we want to try to distract ourselves or think about things more adaptively so that it's helpful. We don't want to focus too much on the things that aren't going well, because it's not super helpful and can actually lead to more distress. So by focusing on things like our breath, for example, we can bring our attention to our body and our mind as it is moment to moment. And mindfulness can begin to help us turn off that stress response that we might have, and help us, stop that cycle. So I'll talk about this more in detail on the next slide. So mindful strategies. So there's two, if you wouldn't mind. Yeah, somebody just said deep breathing, ding, ding, ding. That's exactly correct. So one of the things, and mindful soft yoga, actually, this is cool to see the comments roll in as I'm on the slide. So breathing, we all breathe, but we probably aren't doing it very mindfully. So what I would encourage people to do as just a very beginner kind of get your feet wet in mindfulness activity is start to notice your breath. Start to notice it specifically when you're calm or relaxed or content. And the reason for this is by doing so, you're building a muscle for how to recognize what calm breathing feels like, so that when you're in a situation where you forgot to make that appointment because you forgot to write it down on your calendar, you can bring yourself back to that calm breathing more easily because you know what it feels like and because you can mindfully do that. It sounds a lot easier talking about it than it is doing it. So it really is like a muscle that you have to practice. It's like if I went to go run a marathon right now, it would not be pretty because I have not trained for a marathon. So if I went to go do deep breathing without ever practicing it, it probably wouldn't end well. So it really is being mindful is a muscle that you have to build. But breathing and deep breathing, as somebody mentioned in the chat, is a great place to start. Again, another example is like coming to your senses. So we call this grounding, where you notice the sights, the sounds, the touch, the smells, the sensations when you're calm and relaxed. An example of this, if you don't have an area where you can feel really relaxed or have, things in your environment that, your environment may be more stressful, guided imagery, which there are lots of YouTube videos of where somebody will walk you through kind of a guided tour in your mind, if you will, of like a forest or a beach. And that way you can be mindful to those types of senses and sights in your mind if you can't experience them because of the environment you're in. And again, the application here is using those senses to stay in the moment when upset, to stay grounded so that you don't get caught up in the anxiety of, oh, my symptoms are getting worse. I can't remember this. I can't remember this. Maybe even during the context of this talk, as helpful as it may be, your stress has gone up a bit because you're learning about symptoms that maybe you didn't know you had, or maybe you think you have. So catching yourself in those moments and bringing yourself back to this present moment non-judgmentally can really help over time manage distress, which then hopefully will make your brain fog symptoms more manageable. Next slide, please. So some people might be thinking, well, when can I practice mindfulness? So the beauty of mindfulness is you can practice it at any moment. So when you're walking, when you're when you're breathing, when you're eating, when you're doing more focused practice. So if you're doing yoga, if you're doing an actual mindfulness meditation class, whether it's formal or informal, you can practice it anytime. But I want to really encourage people to remember the piece of it of being non-judgmental, because it's hard to focus on things. And so be non-judgmental about if your brain starts to wander, your mind wanders, bring yourself back to that moment gently and non-judgmentally. So this comic I like because it says, I know there's no way to do this wrong, but I'm sure I'm not doing it right. So try not to do that because that probably isn't going to be the most helpful. Next slide, please. So what we do know is the benefits of mindfulness from a psychological perspective include decreased stress, anxiety, depression, improved focus and memory, as well as improved quality of life. From a neurologic standpoint, we know that mindfulness has been linked to decreased pain intensity, decreased disability, and increased pain acceptance. So getting back to that, accepting versus fighting these symptoms. And next slide, please. So I know Dr. Tuma talked about a lot of research. This is just one program because I think right now, especially in the pandemic, lots of people have been marketing Calm, Headspace, different types of apps to help with things like meditation and mindfulness. So this study out in 2020 looked at using a mobile mindfulness meditation program to improve quality of life for patients with rheumatic disease. And so we see that of participants that enrolled and completed the study, preliminary results showed improvements in fatigue and perceived stress. However, I would say that more rigorous studies on mindfulness application use and barriers are needed to know if these types of apps really do help. And I think somebody said, can you mention those again? I'm going to talk about those on the last slide in terms of resources. Okay, so basically there's really great research being done, not just from a medical standpoint, but also from a psychological and mental health standpoint to see how we can improve the lives of individuals with lupus. Next slide, please. So while research is coming out, we do know that things are really helpful. So one is talk to your doctor. So explain the symptoms that you're having. I saw a lot of people in the chat tonight asking questions, which is great. I would encourage a lot of the people asking about symptoms. What type of lupus do I have? Do I have brain fog? Really talk about that with your doctor to see if there are other tests or treatments that are warranted, and to also just gain information. Another thing is organize. So stay as organized, create routines. A lot of people in that last poll said that they do a lot, which is already really great in terms of taking notes and having a planner, alarms, but really the more organized you are, the less stress you have because you have a routine, you know what's coming next, and it's less work for your brain essentially. So your brain really likes organization and routine. All brains really like that. Kids and adults. Sleep is so important. I can't emphasize this enough that we underestimate how much sleep matters. So really, really, really make sure that in addition to all of the medications and tests and everything you're doing to manage your lupus, that you're getting good sleep. Next, in terms of sleep, like one of the biggest things is cell phones. So like making sure you're putting that cell phone away, 30 to 60 minutes before bed, you're letting your body kind of naturally go into that resting state and getting good quality sleep. Next, click, please. Notes. So we talked about this a lot, but in addition to being organized, creating a note system, whether it's alarms, whether it's paper notes, something that is reliable and you're familiar with so that you know what to do when you need to make an appointment or when you need to remind yourself of something. Okay, next. Eating. So again, with sleep, kind of just basic general health recommendations, exercise, nutrition, hydration, all of those things. I think sometimes we forget because we get caught up with all of the other recommendations that are also so important, but it's just so crucial for those general health behaviors that we have those on lock, because those really do impact our stress and our body's ability to cope. Next. So not just work your body out, but work your brain out. So things like crossword puzzles, Sudoku puzzles, any kind of like brain teasers, have fun with it, keep your brain active. Next. Support. So what I loved seeing tonight was all of the support in the chat. I think I pulled a couple quotes. Someone just said, thank you so much for having this. You're not alone. I'm always here if you need it. I loved seeing that connection already happening. So these I think are great. This is a great environment to reach out to others who know what you're going through, know what it's like to get that support. But in addition, I think support in terms of other people in your life that you can lean on when things do get tough is really crucial. Next. And then if you have all of that support, or if you can't find that support and you realize that you're still really struggling to manage symptoms of, let's say, depression or anxiety, or just brain fog, I would really encourage you to seek out some additional help via a psychologist or psychiatrist or social worker to see if you can get that extra support, because this is really hard. It really, really is. And as much as organized as you can be and as much as you sleep, it's really good to have somebody that you can talk to just feel validated with, and then also to hopefully learn new skills to manage stress if that is something that you're struggling with. I don't have a picture for this, but another thing that I can't emphasize enough is like, do fun things. Make sure that lupus is not your entire life, because it's not. You are people, you have interests, you have hobbies, you have activities that you enjoy, and remember to do those, because that's what helps create a balance. And while lupus is there and it's not going away, at least you can balance it with fun activities that help, one, with stress and, relieving stress, and also can help from a sleep standpoint, nutrition standpoint, exercise standpoint. So really make sure you're getting in fun time, essentially. Next slide. And then I'll end with just some helpful readings and additional resources. So these are some readings specific to mindfulness. And then also there's Dr. Netta Gould from Johns Hopkins, who has a YouTube channel where she does different mindfulness meditation classes. And then the apps that I mentioned are Calm, Headspace, Insight Timer, and then UCLA and UCSD, which these sites are, they have really great mindfulness research sites and centers. So I would go to the websites because they also have mindfulness classes, resources. They're just really great. Have lots of things on those sites. Thank you.
Great. Thank you, Dr. Segan. That was a lot of great information. I saw a lot of great comments in the chat, and I'd like to invite all of our speakers back for our Q&A panel, where we can answer some of those questions that we have had submitted from you all in the audience. You can, of course, still submit those. You can still submit those questions for the speakers through the Q&A function at the bottom of your screen, and we'll try to get to as many as possible. I know I've seen so many pop up. So hopefully we've answered some of those through the slides, but we'll also highlight some of those. So if we want to go ahead and have all of our panelists' cameras back on, that would be great. Okay. If you guys want to unmute yourself as well, we'll jump right back in. And so, Kimberly, I'd actually like to start with you. I know that we had a lot of support for you. And one thing that kind of stood out to me was a question that asked, and Dr. Tuma, you might want to chime in here as well, but how did your doctor in California know that something was different and that MRI was needed? And then they also asked what should their doctor be looking for?
Well, I think, and I guess it lends to having a second opinion type of thing, because it kind of, my geographic location kind of forced me in essence to have one, because I went to one doctor and they didn't do, I had my initial doctor who was treating me and my diagnosing doctor. So he had been doing regular MRIs. Then when I went to another doctor who didn't do anything and then came back to the original, he had to have me back in a baseline. So from there, he just basically had one from when I was with them and then one when I came back. And so that's where he was able to compare the two and see if there was a difference. Sorry, what was your second question? My brain, girl.
It's okay. And it may not be necessarily a question for you, Dr. Tuma. I don't know if you want to chime in. I've seen a lot of questions where people are very curious about the use of MRIs and the diagnostics for diagnosing. So this particular person asked, what should their doctor be looking for? And Dr. Tuma, I know you talked a great deal about MRIs, but if there's anything that you'd like to add in about that.
Oh, sorry, real quick, because one thing, Dr. Tuma, thank you so much. Once you started talking, I was like taking notes because you reminded me of other things that I had going on. One of the other things for me, after I had my stroke, they actually thought that it was a mental issue. And so I legit was in a mental hospital because they thought that that's what was happening. And then they ended up going down the road and figured out that it was a TIA. But what I also ended up getting diagnosed with after I had the brain surgery is steroid-induced psychosis. So when you started talking about psychosis and then steroids, I was like, wait, that's something else that I had. And it literally is I was losing my mind, and it ended up being due to steroids. So now legit, I can't take any type of steroid because it causes me to go into psychosis. And so that's where, just working with your team of doctors, having this type of information, that's why coming to a webinar like this is important, so that if you go through some type of diagnosis, you can say, hey, could this be from that? And it kind of just gives you a launching pad. So it's not just immediately go to a mental hospital. It can be, well, hold on, I'm taking this medication. Can we look down that road too? So thank you, Dr. Tuma. Again, just thank you so much. I just learned so much from listening to you.
Thank you, Kimberly. And you're actually bringing something very important here, the psychosis. And as you said, often patients with psychosis, which can be the first presentation of lupus, can be misdiagnosed to different diseases. And here where the medication can make a huge difference. And particularly, we know what's going to work to control this is prednisone over time. But as I said earlier, we need to treat the symptoms as well with antipsychotic medication if needed early during the course. And later on, once the immunosuppressant and the prednisone kicks in, you can reduce slowly the other antipsychotic medication. And you have said as well something very important. We have to keep in mind as well that prednisone itself, with moderate to large doses, anything above than 20 can increase the chances of developing psychosis in some patients. Okay. And quick comment regarding the MRI. Remember, as I said in my slide, don't start what should I do, is what I have and what are my symptoms and what the doctor and the healthcare team are finding on the exam. Then you can start doing investigation and laboratory tests, because we have nothing specific yet for neuropsychiatric syndrome.
Great, thank you both. That's a really great point to work with your care team. And that kind of brings me to the next question that I saw. Do you have any recommendations, and this is open to the three of you, about working with a team of doctors and informing them of any memory issues you may have? What does that look like when you're trying to balance all of those things as a lupus patient and you're seeing multiple specialists?
Dr. Segan, you want to start?
I mean, I feel like you can go ahead, because
okay, fine. So I think, I can tell you our experience in the clinic, what we're doing right now. And again, probably we're still new on understanding a lot about cognitive function and impairment in lupus patient. But something very important, I can tell you, it's important to collect what we call subjective and objective measures, which means patient-reported outcome about their cognitive function. And you do then the assessment, whether you use a computerized test or with a psychometrist, a very standardized battery of tests. And you need to compare and contrast. And often you're going to be surprised that when the patient tells you, I do have cognitive function, you might not find it when you do your measurement. But still, it's important to highlight on this and see why there is differences and what you should treat there and how can you address this issue.
I think, and I'll add on, just because right now we're working to build a clinic in which I'm more part of the multidisciplinary team, because I was previously, and then we've had a change in medical providers. But I will say, when I have been engaged in that multidisciplinary team, I really advocate for patients to always speak up and ask questions, because I think sometimes they think, oh, this is just part of it. This is what I should be experiencing. But then sometimes it really helps to talk to the doctors, because also from an anxiety standpoint, knowing, even if it's knowing something scary, actually helps us feel less anxious because we know. So I would always really encourage patients to ask questions as much as possible. And something that Kimberly said, she was like, advocate for yourself, like really do advocate for yourself, because communication is always helpful.
And I do agree with you, definitely, Dr. Segan. And one of the things that you mentioned too is kind of keeping our minds going. I do that word searches and crossword puzzles, because I'm like, I need to, like, it's a muscle. I need to do something with my brain. And I can see, like, there will be times you just sit around or you watch TV or you're just kind of in that rigmarole. And it's like, hold on, I need to be actively causing myself to think, so that you don't use it, you lose it type of thing, And so for me, I'm permanently disabled, so I don't work. I'm done with school. So there's all these different things where I'm like, I'm not really using my mind, and I want to make sure that I stay sharp. So that was definitely like a really good tip. I'm glad you shared that.
And I want to as well one more time say how important the multidisciplinary approach and work. So in our clinic, we do have as well involved with us psychometrists, psychiatrists, psychologists, neurologists. All these aspects are very important, especially when you're talking about brain health and brain neuropsychiatric lupus, because some of the question were here, how can you delineate if this is lupus related or not? It is very difficult. And although I said initially in the presentation, the neuropsychiatric lupus that are related to lupus happen within the first 1 to 5 years, but we know with lupus, things are not straightforward and every patient is different. It doesn't mean you can't have neuropsychiatric down the road 10 to 15 years.
Definitely.
Yeah, that's actually a very good point, Dr. Tuma. When I had my brain surgery, in order for them to figure out the psychosis, it was a team. I had a psychologist, a psychiatrist, a neurologist, I don't know, all the other ologists. Like if they studied the brain at all, it was that whole team who had to confer together and see, hey, you know, we tried this, we tried that. So now they were able to pinpoint it to, okay, this is what we think it is. So, you know, y'all are both just spot on, and you're still teaching me things and confirming things for me. And Dr. Segan, like you said, sometimes just knowing this is what this is that you're fighting, that in of itself, it takes away a lot of anxiety.
Great information. I'm going to try to get in two or three more questions. I know we're close on time, but one of the questions that I wanted to ask and that I saw kind of pop up in the chat, you know, I'm going to combine here. Do these types of symptoms tend to get worse with time? Do they level off at some point? Or, you know, do cognitive issues come and go in relation to flares? Is there some type of relationship there? Dr. Tuma?
So if you might allow me to start answering this question, we have just presented the data at the American College this year, and we analyzed actually data on almost 800 patients from UCSF who were assessed yearly with two type of tests. And what we have seen, actually, the good take-home message that there is stability in cognitive function in lupus patient over time. Okay, so if you belong to the group, the category with adequate or normal cognitive function, most probably you're going to continue there. And in patient where there is a cognitive impairment, there is a higher chance of improvement really than worsening over time. That's what we have seen in this study. But mind you, what we have assessed only two aspects. We assess the memory and the recall. So I cannot talk about all other domains yet.
Great. And then another question I saw come in, Dr. Segan, Dr. Tuma, do you have any recommendations for a diet, vitamins, supplements, anything that may help with cognitive symptoms or to improve memory? And I'll turn that over to you. I know that is a difficult question to answer, but I know that I've seen it pop up a couple of times.
I know Dr. Segan has mentioned a lot of important things here. I will let her answer this, particularly with the sleep hygiene, another important aspect.
Yeah, so I'll defer to Dr. Tuma about any kind of vitamins or supplements or things like that, or specific dietary recommendations. But just briefly, if I could give a little plug for some good sleep hygiene. So really putting that phone down 30 minutes before bed could do some real wonders, but also making your sleep environment really pleasant and comfortable, and try to only make your sleep environment for sleep. So no eating in bed, no working in bed, no folding laundry in bed. I mean, really make your bed for sleep and sleep alone, so that your body associates bed with feelings tired and wanting to sleep. And then the way that you fall asleep is the way that you'll want to always fall asleep. So if you fall asleep to music and you wake up in the middle of the night and you don't have music on, your body's probably going to have a harder time. So make that sleep environment consistent. I say this because sleep is so important, and we really do, we underestimate the importance of sleep and how sleep works with our stress and stress management. So in addition to diet and nutrition and physical activity, really do try to prioritize that sleep. And there's sleep, like your phone has, different phones have different sleep apps and things like that. If you want to get a sense of like, how am I sleeping? Because sometimes we think we're getting great sleep, but we might not be.
And regarding the component,
Oh, sorry, go ahead, Dr. Tuma.
Yeah, I was going to say regarding the component on vitamins and mineral, I would say there is no really studies to confirm this. I would just say live normal life, eat healthy, and follow the other recommendation from Dr. Segan.
Okay, great. And I have two more questions. I know we're running tight on time, but one question I saw that I thought was a good question. Somebody wanted to know if there's a way to determine if their forgetfulness is related to lupus or age. I don't know, is there a way to determine that? What does that look like?
I mean, with age, I think there is all of us, we're going to have what we call physiological decline in cognitive function. If this is something particular that they feel it's present and bothering them, I will raise it with their healthcare team. Probably doing a cognitive assessment would be a good idea here, and getting some patient-reported outcome to try to understand really what is the problem, and then you can solve it probably.
Great. I know we're at time, so I would like to close out this Q&A session with one last question. And I just want to ask each of you, what is the number one piece of advice or tip you would give to someone struggling with the effects of lupus on the brain? And Kimberly, I'll start with you.
Between you and Wendy, you both always want to start with me.
You're at the top of my screen.
Okay, that's what it is. Okay, in alphabetical order, right? No, basically, I think it's a lot that we've covered is, writing lists and then trying to remember where you put the list. That's a whole other thing. So I try to put it in, even my appointments and stuff, I'll put it in my cell phone and then in a planner. Because I'm like, okay, one of them, I might remember to look at the planner, but at least if I don't, I know it's in my phone. So it's kind of having different catch-alls. And then that way I feel, more comfortable. So I think just definitely writing stuff down, whether it's your symptoms that you have, because a lot of times we go to the doctor and do you have questions? No. And then you get home, you have a million questions. So it's kind of just I think for me, knowing that I have something written down so that I can hear, I'm taking notes because it was some things that I forgot. So I think that's the number one thing is just constantly having, whether you write it, whether you put it on your tablet, whatever like that, it helps to know that most likely you're not going to forget these things because you have it somewhere, and that getting rid of that anxiety really helps.
Great, thank you. And Dr. Segan, I'll move to you next.
I might try to squeeze two in.
Okay.
One thing is just, be gentle to yourself, because I think there's so much that you're managing and so much that you're having to, just in this series alone, there was so much information I learned. So it's a lot. So just be gentle to yourself. And then the other thing is, if I could squeeze another one in, is set realistic goals. Because if we set goals that are not achievable, you just feel bad. So really try, even if they're the tiniest of goals, it's still a goal that you achieve. So set realistic goals and be kind to yourself.
I love that. And Dr. Tuma?
I would add, work closely with your healthcare team. Try to enjoy life and don't just think about lupus, and develop some adaptive mechanism and how to cope with lupus, because it can be overwhelming.
Great advice. Thank you all so much. And, tonight has been so full of great information, and we know that this is such an important topic and there's a need for more research in this area. And I know that I mentioned Ray earlier in this presentation, but it just really goes to show why Ray is so important. And don't forget to visit lupus.org/Ray and sign up if you haven't already. But again, thank you so much to our speakers for joining us. You were all phenomenal. All of the comments are so positive this evening. And I want to thank all of you for tuning in this evening as well. We appreciate you for taking the time from your busy schedule to join our National Lupus and You education event. We hope you found tonight's information helpful. For more information, please visit lupus.org or contact our health education specialist. Please don't forget to let us know what you think and what topics you'd like to learn more about by taking our survey. And please know that your feedback is highly valued and helps us shape our programs. I do apologize if we were not able to get to your question, but again, feel free to reach out to our health educators if you still do have questions on this topic. Once again, thank you all so much for attending this evening, and have a great night.